uptick of vaccination rates that we have, up from over 300,000 per day down to about 12,000 per day, and now likely dropping to about 5,000 per day. So we expect a rise in the number of cases of respiratory diseases during this period. Indeed, 3 out of the 8 influenza surveillance sites, namely Kakuma, Kenyatta National Hospital, and Nakuru, are reporting an increase in the number of flu cases. We expect to have a lot of more colds and flus with similar presentations like COVID-19. Therefore, there is need for all those with respiratory-like illnesses to seek appropriate medical care and be tested for COVID-19 to inform proper management. The ministry advises the public to take measures that I'm going to ask the Director General to speak to when I give him the opportunity to do so. Ladies and gentlemen, with regard to vaccinations against COVID-19, the ministry has managed to vaccinate as follows. Vaccination status above 18 years old is as follows. Some 8,578,000 are fully vaccinated. Some 2.4 million are partially vaccinated. Some 404,000 have had booster doses administered. 31.5% is the proportion of adults fully vaccinated. Vaccinations of persons between 15 and 18 years old is 1.5 million doses administered, 820,000 partially vaccinated, and 340,000 fully vaccinated. Regrettably, as I mentioned earlier, has dropped. And this is an area of concern because the statistics we are holding at the moment, with about 77 persons currently hospitalized in hospitals, but the evidence we have is that most of the ones in hospitals are persons who have not been vaccinated. A lot of the positive cases we have of persons who have been vaccinated are essentially presenting mild symptoms. So the solution, ladies and gentlemen, is number one, we need to revise our vaccination rates. Kenyans are advised to get vaccinated. Those who have not been vaccinated should do so immediately. Those who have been vaccinated and need the booster shot should take the booster shots immediately. And we appreciate that mask wearing is also part of the measures that we are supposed to be. And we explained earlier that the measures that we took at the time that we did them was as a result of the fact that we had gone down. But with regard to wearing of face masks, the mandatory wearing of face masks in open public spaces, where one is not in close proximity with another person, remains optional. However, one is required to wear a mask when in contact with other people in close confined spaces such as PSVs, aircrafts, offices, supermarkets, marketplaces, and places of worship. All persons, indoor meetings to continue at full capacity of the venue, but provided that people take measures to be fully vaccinated in order to do so. And all attendees are required when indoors to be wearing masks. We have seen situations, for example, in political indoor meetings, where we are getting super spreading at a very fast rate, as you have seen for yourselves. So citizens are urged, Kenyans are urged to ensure that they wear masks and are fully vaccinated who are to attend those meetings that are town hall meetings. We are not restricting the in-person worship, and we shall continue to do so in full capacity, again, as long as all the congregants and worshippers are also fully vaccinated. We also require worshippers to wear their face masks while inside the places of worship. All international travelers arriving into the country and who are fully vaccinated are exempt from the requirements of a PCR test and are exempt from quarantine upon arrival in the country. All unvaccinated travelers arriving at any port of entry into Kenya for whatever reason are required to be in possession of a negative PCR test results conducted not more than 72 hours before departure, regardless of the route of entry. You appreciate that the reason why that particular clause exists is because sometimes, especially in the walk-in boundaries, it is possible that a person can walk in without being fully vaccinated. Otherwise, on flights from overseas and elsewhere, it's very clear that no traveler is to come into the country until they are fully vaccinated and fully boosted. Unvaccinated travelers arriving at any point of entry will be subjected to a rapid antigen test at their own cost. Any person who tests positive to an antigen test is subjected to entry to a PCR test at their own further cost, and are self-isolate again, according to our guidelines, at their own further costs. All passenger services, as in vehicles, trains, and domestic air services, will continue operations at full conveyancing capacity. I'm urging county health departments.
And that is the Health Cabinet Secretary